on healthy aging from a neuropsychological perspective. As you can see, we're doing things a little bit differently in that we're broadcasting from our HASP classroom. And while it's not the first time we've done that, we're going to try out a more interactive format, which will hopefully make you feel more like you're back in the classroom. At any rate, it's my pleasure to introduce today's speaker, Dr. Shannon Connell. Dr. Connell is a neuropsychologist and has a private practice, Neuropsychological Associates of West Michigan on 8th Street in Holland. She holds master's degrees in counseling psychology and clinical psychology and a PhD in clinical psychology with a neuropsychology concentration. Dr. Connell has conducted presentations throughout West Michigan to increase exposure to the benefits of neuropsychological assessment. On the basis of that criteria, she has conducted trial studies and research into easily accessible interventions for increased brain health. Many of these interventions are free and can often be used at home. Today, we're going to view holistic approaches for maintaining cognitive health. And with that, I will turn it over to Dr. Connell.
Well, thank you, Susan and Pat, for the introductions, and Susan for taking care of all of the technology issues. It's a pleasure to be here this morning and to present for the HASP program. I decided to make it a little interactive due to the pandemic, and also I don't do well just sitting in front of a screen for an hour and a half. I'm used to being one-on-one with people or with their families. So we're going to get started, and the presentation has two components to it. The first half will be clinical, and the second half will be the tools to enhance healthy habits for a healthy brain. Susan delineated when we'll take questions. We do have a lot of information to go over, and then I will be getting into these tools from a more interactive perspective. So basically, you may be also asking, what is neuropsychology? Well, as a neuropsychologist, we measure a patient's overall pattern of cognitive strengths and weaknesses. And we do that by administering neuropsychological tests. They provide an assessment of current functioning, and it assists in differential diagnosis. The interpretation of the data I collect will lead me to a diagnosis and recommendations to improve the patient's quality of life. We work off of manuals such as this, which contain all of the tests that we administer. There we go. So what are we going to be looking at today? What is the goal of this presentation? Well, I'm going to be addressing what is normal aging, and from a neuropsychological perspective, what is normal and abnormal cognition, and then we're going to do some healthy habits for a healthy brain, but we're going to have a little bit of fun with that, and then at the end, some more discussion and questions. So what is normal aging in general? Well, aging is a part of the normal life cycle, and it's true, we all age. And so it is normal to age. All of us go through the process, but it does not automatically encompass a loss of cognitive function. There is a decrease in bone density, muscle mass, respiratory and cardiac capacity, and a decrease in immune function. There's an increase in blood sugars, abdominal fat, and blood pressure. So we all wonder about this big M word, which is memory. That seems to be the most disconcerting issue that many people face. So we are going to have some forgetfulness, and most memory lapses are not a cause for concern. Age-related memory changes are not the same as a dementia process. Short-term memory is fragile and it's easily disturbed by interruptions. And some memories are meant to be retained for just a short period of time and then discarded. Significant memory loss is not an inevitable part of the aging process. As one becomes older, physiological changes cause change in brain functions that we've always taken for granted. So it takes longer to learn and recall, and our mental processes slow. So what, again, is normal? Normal things that you may observe are forgetting where you left things, forgetting names, forgetting an appointment, walking into a room and forgetting why you entered. You're more distracted and not being able to retrieve information on the tip of your tongue. Trouble remembering what you've just read or details of a conversation. And there's an area in the brain that we will be reviewing, and that's the hippocampus. And that's involved in the formation and retrieval of memories, and it deteriorates with age. So mental abilities that are unaffected by normal aging, you're able to engage in things you've always done and continue to do so. The wisdom and knowledge you've acquired, which is sometimes hard earned, but that is something to celebrate as well. Common sense, that does not decline. Ability to form reasonable correlations about relationships, kind of assessing situations, maintaining conversation. These things are, we retain these factors within the normal aging process. So, yeah, let's talk about some vibrant people that have really contributed later in life. Some of my screens cut off a little bit with the pictures, but Julia Child at age 36 moved to Paris and began learning to cook. Ellen DeGeneres married at 50 for the first time. Mark Twain wrote Huckleberry Finn at age 49. Helen Mirren won her first Academy Award at age 61. And Colonel Sanders, after working several low-paying odd jobs, at age 62, opened his Kentucky Fried Chicken. Frank McCourt published his first book at age 66, Angela's Ashes, which won a Pulitzer Prize after a successful teaching career in New York City. Mother Teresa won the Nobel Peace Prize at age 69. Louise Bourgeois, at age 71, gained fame late in her career. Her sculptures can be seen at Myers Gardens. Joan Didion began modeling for the French brand Celine at age 80. Millard Kaufman co-created Mr. Magoo at age 86. Harry Bernstein published a memoir at age 96. Fahad Singh completed a marathon at age 100. And in our own community, we have a noted former poetry professor, Jack Riddle. Every week, he is on Facebook reading original poetry and musings of his for the week. So what is normal aging in the brain? We're going to review this. It is a loss of neurons. There are protein deposits. There's an accumulation of cell debris and dendritic arborization. So what does all that mean? We're going to review that. So there we have a neuron, which is so incredibly important for communication with the brain. So there's a little picture of it. So I'm going to go back one moment there. I can. Yeah. So in this neuron is a lot of information processing. The soma, or the nerve cell, is responsible for the processing and production of neurotransmitters. The axon are pathways that extend from one soma to the other. So it communicates these electrical impulses to other networks of neurons. They are wrapped in myelin sheath, and these bundles of nerve fibers are called white matter. At the end of each axon, the axon terminal, the neuron releases chemical messengers, these neurotransmitters that we mentioned. So what happens in normal aging in the brain for the loss of neurons? This neuron is the basic cell of the brain. It gives rise to all of our complex activities and regulates behavior. So neurons create impulses that transmit all this information in the brain and throughout the peripheral and central nervous system. This wonderful cell provides this extensive network of connectivity between other neurons, but different parts of the brain. And brain connectivity is the key to brain functioning. So neurons, most of them are present at birth. But what is so fascinating as we age is less than 2% of the original supply is lost by the age of 70. Evidence that neurons may regenerate through adulthood has been noted in some areas of the brain. The creation of these new neurons is referred to as neurogenesis or neuroplasticity, and has been observed in the hippocampus and caudate nucleus. So I put yay there because we are going to be doing some tools to increase this neurogenesis within the hippocampus, which is the place that houses the memories. Neurons do not pass one another, but a synapse structure permits the neuron to pass this signal to other neurons. So often that presynaptic part is located on the axon, or you just saw that picture previously, and the postsynaptic part is located on the dendrite. So again, this communication is so important between neurons because it's made through neurotransmitters, which we will elaborate a little bit later in the presentation. And these neurotransmitters are the chemical agents generated within and secreted by stimulated neurons. So this is very important for the connectivity of messages within the brain. And again, I mentioned that we're going to be doing some tools to enhance this. Another factor for aging in the brain is protein deposits. And one form is the beta amyloid 42, and it is thought to be toxic and in an abnormal level in Alzheimer's disease. So we talk about changes in the brain. When there are these protein deposits, they are going to affect the brain. What happens is they clump together and form these plaques. And the plaques collect between these neurons, and then our cell functioning is disrupted. So this amyloid beta protein deposition causes this miscommunication between neurons. And this pathological tau protein leads to the death of the neurons. And this amyloid can be found in brains of older adults, but who do not experience cognitive decline. And findings indicate this tau protein as impacting a decline in cognition and memory loss. Tau may be leading to the death of the neurons, whereas amyloid may be causing the miscommunication between the neurons. So this is what may be existing when someone has a dementia process, such as Alzheimer's disease. There is an accumulation of cell debris in the brain, and the cell debris is removed by the immune system, which is why we work on a high level of immune functioning in the system. The dendritic arborization, that's the little tree-like formations, the dendrites receive information from other cells and conduct it towards that cell body or the soma. And then the cell body integrates the information and passes it on to the axon. So if there is pruning in these dendrites, there is going to be a reduction in making these new synaptic connections. Okay. So when we talk about brain weight loss or atrophy, really that loss in the brain is about 2% per decade. There is neuronal shrinking and loss, but we're going to review some tools to work on that. There is ventricular enlargement. There is diminished neurotransmitter activity. And why I keep bringing up these neurotransmitters, there's one that is named acetylcholine, and it is believed to underlie the memory deficits associated with Alzheimer's disease. So we've recognized that neurotransmitter is less functioning in patients with Alzheimer's disease. You may be familiar with some of those inhibitors, such as Aricept, donepezil, Exelon, that are prescribed to enhance this neurotransmitter function of acetylcholine. So there is what we call this memory medication that some physicians are prescribing. We reviewed the increased amyloid burden as well. The brain regions involved with memory processing, such as the hippocampus and especially the frontal lobes, undergo age-related structural and neurochemical changes. And the hippocampus actually shrinks a little bit in size as well. That integrity of the white matter, which is included in the wiring between the neurons, declines and kind of slows the processing speed. This is normal, but we want to encourage these healthy habits for a healthy brain. And we will review that the second half of the presentation. Additional contributing factors to aging in the brain. We have these wonderful factors called telomeres, and they're a marking of cell aging. They are little cuffs that cap the end of our 46 chromosomes. And these thread-like structures are nestled in the nucleus of every one of our chromosomes and our 100 trillion cells. So we want to protect this integrity from degradation and erosion. And we're going to review some things also. There's an enzyme that repairs and maintains the telomerase. And when this level falls off, this enzyme decreases as we get older. It also contributes to the aging process. The telomeres comes from the Greek words telos and meros, meaning end and part. And these caps are stuck at the end of the chromosomes to protect our DNA. And we talked about each one of our cells contains 92 of them, one on each end of the 46 chromosomes. The other thing that contributes to aging is inflammation. And we just talked about, we like to have a strong immune functioning. And inflammation may be caused by stress because it can elevate the cellular damage from free radicals. All right, so now we're going to review what is normal and abnormal cognition on a continuum. And we're going to go from normal to normal because as we age, things do change. So when we do a diagnosis of cognition, we work off certain criteria. So the first one is normal or typical. And then the next step is kind of an age-related cognitive decline. Then if there's more of a decline, we're looking at what's called a mild neurocognitive disorder, formerly called mild cognitive impairment. And then we look at major neurocognitive disorder, which moves into the dementias. If we look at it operationally in cognition, even in the 30s and 40s, you can really cultivate math, physics, that type of intellectual stimulation. Age 40 to 50 is still strong for biological sciences. And when we move into ages in the 60s and 70s, we can cultivate more of literature, art, music. So what is normal aging and what is age-related cognitive decline? In normal aging, we are going to experience a slowed processing speed, some cognitive inefficiencies, especially divided attention, but it is not uniform across all cognitive domains. We're less likely to think outside the box, but elders can still master new information. It might just take a little bit longer. So what happens next? Following the age-related cognitive decline, we move into a diagnosis of impairment as defined by the ICD-10, which is used by medical professionals, and the DSM-5, which is used by neuropsychologists. So we communicate with these diagnostic codes. And where it's defined by these two criteria. Okay, so hold on. There we go. Okay, so if we look at diagnosing what something is diagnosed as a mild neurocognitive disorder, we look for impairment that's greater than expected for someone's age and education. So it's two things that we base our criteria on. One, we need a subjective concern where an informant mentions some of the issues that they have noticed. Another thing is that the basic activities of daily living are preserved. From an objective assessment, neuropsychological testing tests multiple domains. And we're looking if someone falls in a performance of 1 to 2 standard deviations below the norm for age, education, and culture. So that means they're functioning between the 3rd and 16th percentile. Oh, I want to go back here. So the deficits that we may look at include episodic memory, processing speed, executive functioning, verbal ability, and attention. Mild neurocognitive disorder with memory problems and other cognitive deficits are at a higher risk for a conversion to an Alzheimer's type dementia. But mild neurocognitive disorder patients that they can be amnestic or non-amnestic. Amnestic is memory loss. Non-amnestic type of dementia includes the frontal temporal dementia, dementia with Lewy bodies, and a vascular dementia. But another consideration is that before we look at everything, we have to rule out physical factors, which may be low vitamin B medications, or what we call a pseudo-dementia, which is when the patient is fairly depressed and the depression is causing a diminished level of cognitive functioning. So after we look at a mild neurocognitive disorder, we then look at the dementia processes, and they are bundled under a major neurocognitive disorder. The term dementia relates to the condition of cognitive decline and functional impairment. So why we look at this is different types of dementia are associated with distinctive brain abnormalities and cultivate a differential profile. And the neuropsychological assessment provides this profile and creates a diagnosis based on testing all of these multiple areas of functioning. Now, again, when we want to look at if there's any medical conditions as well, neurologic concerns, which may be tremor, gait, seizures, genetic vulnerabilities. I want to just note that often patients may go to their primary care physician and have a brief screening of memory. And often they don't do really well on it. But the standalone assessments are just more of a screening. We do not use those for our diagnostic criteria because they can result in as many as 1/3 misdiagnosis. So we look at it as perhaps the patient was confused, being kind of thrown into an assessment they weren't prepared for, things like that. But the neuropsychological assessment provides extensive detail into the cognitive profile. So when we look at these cognitive domains, the brain is multifaceted. So we are going to be looking at attention, and attention is basic or complex. So we measure alertness, processing speed, visual attention, auditory attention, sustained attention, divided attention, and working memory. Working memory holds some information while it manipulates something else. So we measure attention in multiple tasks. We look at executive functioning, which is planning and organizing, abstract thinking and reasoning, mental flexibility, which is the ability to shift from task to task, initiation, actually initiating the task, and inhibitory control. Yeah, I want to add something else. Now, memory is the big one. We all wonder. Now, what's so interesting about memory? It has so many different components. Stage one is when we encode, and encoding means acquisition. So we're trying to access the material into the part of our brain for memory. Now, to enhance encoding, you need to pay attention. And it's easier to encode when you're tending to something. So sometimes you say, well, I just don't remember that. But if you just think about paying attention to it, you're probably going to be able to encode that information a little more easily. We also try to store it and retain it, and then we retrieve it or recognize it. And we have long-term or remote memory, and also verbal and visual memory. So this consolidation or storage happens when it's more efficient if you already have some rich associations about the material. Ever notice that people that follow sports teams can name any player on their team, but if they're next to someone that's not following the sports team, they're not really going to remember the players. They're not invested in that. They don't have the rich associations that the other person may have. Consolidation also occurs if events affect you emotionally, or they have emotional valence. They have a meaning for you. You're going to remember those a little bit more. Now, retrieval, if your neuronal pathway is in the brain with integrity, you're going to access that information. You'll eventually retrieve it. Maybe it won't be right away, but you will get there. Okay, so there we go. All right, so other domains include language. Now, language encompasses two components: expressive, which is how you get your words out. It's fluency, articulation, how you organize it, and writing. Whereas receptive is naming, comprehension, and reading. We also measure visual, spatial, and motor ability, the perceiving, understanding, conceptualizing visual and spatial information. There we go. So I had this little picture just to show you how complex our brain is. All of these different parts of the brain receive information from this complex kind of communication system. And each part has this distinctive use. So it is quite complex. And then there we have the hippocampus, and we're going to be working later in the presentation on some neuroplasticity in the hippocampus, because that is the area of the brain that we can increase that neurogenesis. So we're talking about a complex structure, but we're going to simplify it later and work on these healthy habits for a healthier brain. So at this point, before we move into our question portion and our kind of tools for healthy habits, I just want to add one more thing before we take questions. When we move into a mild to major neurocognitive disorder, the incidence of dementia increases for each year over the age of 65, which is why I'm so interested in healthy habits to kind of deter that process that moves into a dementia process. And when we look at these deficits, we do measure them according to standard deviations in this norm sample. So if we're looking at normal aging, even if it's measuring at a one standard deviation below the mean, we're still not going to be looking at even a mild neurocognitive disorder. So we want to do healthy habits to offset the incidence for increased dementia process. So if Susan is available, we will stop for 10 minutes of any questions, and then we will move into the healthy habits and more of an interactive type of presentation to give you tools to enhance brain and cognitive functioning.
Thank you, Dr. Connell.
Yes.
I have requested questions into the chat, and I don't see any right now.
Okay, great.
But that certainly doesn't mean that people aren't thinking about some things. I wonder, do you want to give people a moment to type a question into the chat, or would you like for people to just unmute themselves and ask a question?
Well, let's do this. Since there aren't any pressing questions, the second half of the presentation is this healthy habits, and it's fairly interactive. And I think there'll be more questions with that portion of the presentation. So if you have a question now, just you can hold on to it, and we'll get to it at the end as well. Because I would like you to be able to understand these healthy habits, and we're going to try them. So let's go with that. If you have a pressing question, we'll get to it at the end. And if you need to take a break, go ahead and take your break, but we're going to keep going if that works for everyone. Okay? How's that sound, Susan?
That sounds great. Sorry, I muted myself right before you asked that.
She's handling a lot today. So, all right, so let's go into healthy habits. So what we can do as we age, and all of these are going to be free, and why I'm presenting some of them during a pandemic, you're going to be able to utilize these tools in your own home as well, or outside as well. So the healthy habits for a healthy brain. Now, when I present something, I present evidence-based material, which means it has been researched. There has been found some significant findings that these actual interventions work. So through my extensive research, these are the healthy habits that have been empirically evidenced. So let's look at it. We are going to review neuroplasticity, which we mentioned in the first portion of the presentation, good food for a good brain, review alcohol for a moment, socialization, physical activity, mental stimulation, meditation, staying healthy, and spirituality. Now, everyone is individual, so you do not need to do all of these. You will do the things that resonate with you. Okay, so we talked about this neuroplasticity, and hold on one second here. Okay, so neuroplasticity is the brain's ability to respond and adapt to changing circumstances, but increase the capacity in response to sustained experience. Basically, we want to create new growth in the brain, in that neuronal pathways. So although research is still being explored, the general findings support enriched environments, exercise, and different trainings, which we'll review. So when we look at neuroplasticity, we talked about the hippocampus earlier. And so, and we'll review a couple studies that support this. So one study showed that the hippocampal area of London cab drivers were larger than control subjects. So they had to use, they had to increase their memory load of all the streets in London. Another study showed that juggling training was associated with increased gray matter. So how do we cultivate this? Well, it's actually quite simple. You can practice new tasks intensively and make the practice context difficult. So when you practice a new task, you want to make it a little bit difficult. And we'll go into some of those tasks as well. And we'd like to have some external stimulation. And that is challenging during the time of pandemic, but we're going to review a couple of those things as well. You want to sustain engaging in these novel tasks. You want to make demands on your cognition processes like speed, working memory, episodic memory, and reasoning. We want to increase aerobic exercise. We want to enjoy the tasks. We want to, the brain training programs that are out there and cost money, they're not really supported by the research that these other tools have been examined. And all of these things that we're going to do today, you can start some of them right at home. So overall physical health, emotional well-being, stress level, and sleep quality exert a huge influence on how you do learn and remember. So those who are socially, mentally, and physically stimulated tend to show greater cognitive performance with a brain that appears younger than its years. So that makes sense. We're talking about all of these kind of interactions that create this brain health. So first, we're going to start with one that's fairly easy, the good nutrition. So nutrition for a healthy brain includes omega-3 fatty acids, more fruits and vegetables, wine, legumes, fish and shellfish, nuts, poultry, sauces that are made with tomatoes, onions, leeks, garlic, and olive oil, whole grains, limiting processed foods, and limiting fried foods. So this, let me just get, so the Mediterranean diet is one rich in fruits and vegetables and omega-3 fatty acid. So research has really supported this for a healthy brain. Using this diet, participants experienced a 38% less chance to develop Alzheimer's disease over the next 4 years. And in one study of 7,000 people, after 5 years, those on the Mediterranean diet were 30% less likely to have a cardiac event. Another study, here's those telomeres again that we talked about earlier, examine the effects of the Mediterranean diet on telomeres. So that's that cell aging. We want to cap those chromosomes. So those who adhered to the Mediterranean diet had the healthiest telomeres. It's also been associated with a slower cognitive decline. So that's moving from the age-related cognitive decline into the mild neurocognitive disorder, into major neurocognitive disorder. A study of 923 subjects aged 58 to 95 showed that adherence to a Mediterranean type diet decreased the risk for an onset of Alzheimer's disease. In another study, more than 17,000 people, average age 65, were 19% less likely to have impaired mental functioning. And another study found adherence resulted in 30 to 35% less likely to perform poorly on tests of mental functioning. Yes. All right. So here's the goals of the Mediterranean diet. It's fairly simple. 3 servings of fruit, 3+ servings of vegetables, 3 servings of bean per week, olive oil, omega-3 rich, nuts, whole grains, limiting cheese and red meat, and avoiding commercial products. So the Mediterranean diet includes, some of you may be familiar with the dietary approaches to stop hypertension, which the acronym is DASH, or the Mediterranean DASH diet intervention for neurodegenerative delay, So basically what you want to remember is what's good for the heart is good for the brain. Let's go on here. So here's another study. So our brain health is affected by our diet. 4,213 participants adhered to this type of diet, and they increased their brain volume, gray matter volume, white matter volume, and hippocampal volume. I have some props here as well. So there's a couple other things. I'm showing you walnuts. It's noted that 8 walnuts a day also promote brain health. I'm showing you steel cut oats, has to be steel cut. Cocoa, the dark real cocoa, and cinnamon has helped decrease inflammation. So again, these easy tools to just incorporate in your daily diet. If you're unfamiliar with the Mediterranean diet, the library has excellent resources on it as well. So we're going to just talk about alcohol for one moment. Multiple studies indicate that a moderate amount of alcohol creates a reduction for dementia process. So moderate alcohol for men is 1 drink. For women, it's 2. It's been linked to a lower risk of heart disease, heart failure, stroke, and dementia. And it increases blood flow and helps lower blood pressure. This does not mean that you have to use alcohol, but those have been questioned before. The thing about it is you will recognize if there's an impact on your cognitive function, and you will recognize if it is impacted by alcohol. And sometimes just a small amount of the red wine adheres to that Mediterranean type diet, and that means 4 ounces. So we're moving into socialization, another key component to brain health. Socialization means staying involved, maintaining a purpose in life, keeping around friends and family, building new friendships, being with others, and isolation is a risk factor for health decline. Isolation increases risk for breast cancer, impairs immune function, boosts inflammation, increases risk for heart disease, reduces survival after cardiac surgery. So, very difficult to be doing during pandemic times. Difficult when people are not comfortable talking to a screen. So this is really impacting what is going on currently within our society. There is a lot of clinicians focusing on the emotional stresses this is creating for patients. So even if it means you stand on your front porch and wave to a neighbor, or you attend your church virtually and go to the coffee hour, just any reaching out at this point, I think HASP is a wonderful opportunity as well, engaging in something that we can do at this time. So the benefits of belonging, it helps promote healthier self-care, is associated with lower levels of stress, lower levels of anxiety and negative mood, lower activation of the sympathetic nervous system, the fight or flight, lower stress hormone levels, and more restorative sleep. And researchers have found that the higher the individual's level of social interaction, the better the mental function, because social interaction often goes hand in hand with intellectual stimulation. Carrying on conversation exposes you to new information and forces you to frame your thoughts in different ways. Social relationships can provide support during stressful times, reducing the damaging effects that stress can have on the brain. So again, this is challenging. So I encourage you to look at, we talked about novel tasks, to look at ways to socialize in a novel way. All of this is challenging, and it is challenging the brain, but rather than view it negatively at all times, we can think of this as challenges and learning new tasks as well. All right, we're going to move into physical activity. Why it is so important. Well, exercise improves your lipid profile. It reduces blood pressure. Adults with hypertension are more prone to memory impairment and experience more severe memory loss. It increases the risk for dementia. High blood pressure accelerates the buildup of plaque in the arteries that impairs circulation. So a reduction in circulation can slow blood to the brain, which can harm neurons. If the blood flow to the brain is blocked, brain tissue can die. So each episode of damage, which is actually a tiny stroke, affects a small area of the brain, and symptoms may not be apparent until the tissue has been destroyed. Physical activity improves your mood, and it improves insulin sensitivity. So physical activity, we want to stay mobile, stay active, walk, stretch. Older adults with mild neurocognitive disorder showed significant improvements on tests of executive functioning after 6 months of a 4-day-a-week aerobic exercise. So walking 72 blocks a week was associated with greater gray matter volume and a 2-fold reduction risk of developing cognitive impairment more than a decade later in a study of elders. So it just keeps on giving if you engage in exercise. A meta-analysis of 30 trials in older adults with dementia found that exercise improved physical fitness, physical function, cognitive function, and positive behavior. So recommendations, let's see. Okay, let's go on to that. So recommendations for exercise. Aerobic exercise, 55 to 90% of your maximum heart rate, a model level of intensity, 30-minute a day for 5 days a week. And moderate intensity is better than low or extreme, and the moderate duration is 31 to 45 minutes, which is better than less than 30 minutes. Resistance training. And resistance training is weight training of 8 to 10 exercises, 10 to 15 reps of each, 2 to 3 times a week. Flexibility training and balance exercises. Now, to gain the benefits of this requires adherence for at least 6 months. Long hours of sitting reduces the blood flow to the brain. So we want to really encourage this aerobic exercise. We really want to add that, and it's free. You can get bands for home or small weights. There's excellent programs in Holland at Evergreen when it reopens, but right now, all of these things that I'm recommending, you can do at home or outside. So we're going to, one challenge, you can go to the library. They have a lot of great books, and you can kind of challenge yourself for new tasks, you know, where you can go for new hikes, things like that. and take your mask because some people are not adhering to safety protocol, but trying novel tasks as you increase your aerobic activity. Okay, so when we look at physical activity, there has been some research on dance, and dancers are kind of brain scientists of sorts. They really understand the interplay between learning, memory, and the relationship between the mind and body. And new research about how we remember has yielded vital clues, how we learn movement again through visualization. And this learning and memory new movement utilizes regions of the brain that may help to improve memory as we age. So, we are now, if you are able to stand up in your home, you do not need to do this, but we are going to learn one move. So, and then I want to know how later, how hard it was. So if you are able to stand in your home, go ahead and stand up. You will not need to watch the screen. I will talk you through this. So gentlemen, we'll start with the gentleman. You will stand up and you'll put your arms as if they're in an armchair. If you are watching this with someone, please have social distancing, which is about 6 feet apart. So gentlemen, I want you to step forward on your left foot, forward on your right foot, step to the side with your left foot, bring the right foot together. Again, forward on the left, forward on the right, side with the left, together with the right. Okay, you can practice that for a moment and see if you remember it. And ladies, arms in an armchair, you will step back on the right, back on the left, side to the right, and together. One more time. Back on the right, back on the left, side to the right, and together. Okay, now we will do it both men and women, and we'll go through it twice. Arms in an armchair, and step, 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 together, step, 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 together, and rest. You have now just learned the foxtrot. So one thing that we really promote dance later in the years is because it activates so many parts of the brain. Now, why am I interjecting this tool during a pandemic? Because it's one thing you can access on the computer. There are so many videos out there with music and steps, and it will really challenge you to learn a new task. Now, when we think about physical activity, we are able to do it in a beautiful area in West Michigan. So I encourage you also to get outside and do some of your physical exercise within the beauty of West Michigan. Okay, we're going to move into mental stimulation. Perhaps the biggest component of change is involvement in later life, is engaging in intellectually and socially stimulating activities, reading books, puzzles, volunteer work, traveling when we can, card games, etc. And these activities have been shown to enhance thinking and memory and attention control processes. So we increase this brain reserve capacity. So many of you are probably already reading, we're volunteering before the pandemic, doing card games, puzzles, things like that. So cognitive training we can do at home. It includes puzzles, handicrafts, and life skills, and they're known to reduce the risk of cognitive problems. They increase well-being at later life, and they help slow the process of dementia among the elderly. So I'm going to demonstrate another tool. When we look at something like the handicrafts, I'm going to illuminate that for a little bit. Some of you have taken up handicrafts, and what's great about these are knitting needles. What's so excellent about handicrafts, whether it's woodworking, knitting, crocheting, or anything that involves both hands, we're activating both sides of the brain. So I want to encourage looking at new novel tasks, learning a new handicraft project so that you can use both sides of the brain. Also, it increases the dexterity in the stiffness of your hands as you age. Now, again, during a pandemic, it's hard. So there are YouTube videos that are very good instructional materials for handicrafts. And again, it's something you can add at home. You can learn a second language. You can prepare for when you may travel in the future. So right now you can be preparing by learning a second language, and that is very good for the brain as well. You can listen to more music or attempt to learn an instrument, some small little instrument. For right now, I think the ukulele is becoming popular. So that's mental stimulation. Now we're going to go on to meditation. Now meditation, when I view meditation, I'm viewing it for reasons of this presentation as a non-spiritual component, because meditation has been researched for many, many years, and the benefits of it for brain health are expansive. So the neuroscientific study of meditation has involved clinical research and aims at understanding how mental and spiritual training affects the brain, body, and health. And neuroplasticity experienced induced changes in brain activity and anatomy have been a driving force of this research. It's now recognized as so important to our health, well-being, diminishes depression and anxiety, and increases our cognition. So there are multiple factors that are involved in a meditation type practice. And meditation may also be called a mindfulness practice. It can be kind of correlated. So if we look at a meta-analysis, we'll just look at this briefly. Different types of meditation activate different areas of the brain. And research has been so extensive on this, and it's really something we're going to look at in this presentation. So there are, my research is primarily focused on open monitoring and focused attention. My research was a trial study for the Alzheimer's Association entitled The Effect of Focused Attention and Open Monitoring, Meditation on Resilience and Psychological Well-Being in Caregivers of Persons with Dementia. My findings included that focused attention and open monitoring increased resilience and psychological well-being. But the data analysis revealed a statistically significant difference in resilience at the different time points for focused attention and open monitoring. The scores were higher for resilience in the focused attention group, but both groups benefited, they increased resilience and psychological well-being. but the focused attention group increased resilience a little bit more. So to demystify this topic of meditation, we're going to practice a little task. And so I have a little container of what I call tokens. I'm going to show a couple of them. So I have a little stone, another little stone, or a little piece of driftwood, or beach glass. So what I want you to do is take a moment and gather something that you have at home that would be something called a token, without emotional valence, without emotional meaning. So not a picture of someone you love or a piece of jewelry, just something that you have at home that you like, that's you like to look at. And I want you to just take that. I'm going to call it a token. Now, what I want you to do is we're going to do the focused attention practice. I like this practice because it's decreases the kind of the influx of intrusive thoughts. It's very easy to practice, and you can do it in your home. So go ahead and take your token. I'm going to use this little crystal, and I want you to put it in front of you so that your gaze is slightly downward. Now, you don't have to look at the screen right now during the presentation. I'm going to walk you through about a 1-minute practice. So go ahead and just gaze at your token. You're going to keep your eyes open and have it about so that your gaze is slightly down. You're going to gaze at your token, and we're going to start about a 1-minute practice. Bring your attention to the token in front of you. You may find thoughts come and go, but continue to bring the focus to the token in front of you. Let the other thoughts come and go, and continue to bring your gaze to the token in front of you. Now come back out and bring your gaze back to the screen. So ideally, you can practice that every day. You can start off with 1 minute, work to 3 minutes, 5 minutes, and then 10 minutes. And this is an easy meditation type practice to do at home that will increase the neuroplasticity as well. And then these are areas of the brain and what they do. So staying healthy is so incredibly important as we age. So you really want to manage your hypertension, your hyperlipidemia, obesity, diabetes, any vascular diseases, any sleep disorders. And because uncontrolled high blood pressure in late life has been linked with Alzheimer's disease. So again, all these tools that I presented today will assist in managing your health as well. So they're healthy for you physically and mentally. The last thing that we're going to review is spirituality. And again, research has really supported this as an opportunity for neuroplasticity. And it offers us to release one pattern or pathway and allow another form without an obligation to one path. It creates new opportunities to learn new information as well. And a spiritual practice provides an inner landscape that we can explore. And when we engage in new perspectives, we create these new neural pathways. Our fixed associations become a little more permeable. And these practices have shown definite neuroanatomical and neurochemical changes in the studies that have been conducted. We recognize that our spiritual practice, when it's not a pandemic, makes us go out of the house, be in a different environment, be social, be connected, all of these things. So it is difficult during a pandemic. But if we continue to explore spirituality, it does offer an additional opportunity to create neuroplasticity within the brain as well. So today's presentation, oh, wait, I have one more, sorry. The word spirit comes from Latin and it means breath. And it does encompass a connection to something greater than ourselves. It helps us find meaning. And it also helps in psychological health. So a study of 12 volunteers demonstrated that it does increase this brain health as well. And there has been studies for using neuroimaging, which is MRIs, for structural evidence for this neuroplasticity. So when we look at spirituality also, it kind of opens us up to these new experiences and neuroplasticity as well. So we didn't have any questions. Let me see if I have any other props. I have a lot of props here, but and books and things like that. But I'm just going to encourage you to do these free tools in your home during the pandemic. And then when things lift up and you can go engage in them in different environments, I'm going to encourage that as well. So I will take questions now and I'll have Susan kind of moderate this, but thank you all for listening and being here with us this morning. It was certainly a pleasure for me as well.
Thank you so much, Dr. Connell. There are actually 6 questions approximately in the chat. So I'll start with the one that came right after the first segment from Janet McGinnis, and it reads, motor cortex. Can an earlier in life injury like concussion affect us later in life by affecting motor skills?
So that's a question. Let me just make sure I understand the question. We get pretty specific in neuropsychology. So a previous concussion, and was there damage to the motor cortex?
So Janet, if you want to expound on that, just unmute yourself. And if you're not comfortable doing that, we can move on to the next. Go ahead.
I can answer it. I'm all right. So I would need to probably see the medical records so that I could really understand the scope of what the damage may be and specifically in what area. To answer that question generally, because it is a really good question, when we find a previous injury, which could be concussion or a traumatic brain injury, something like that, to begin reviewing the case, we look at previous medical records so that we can see documentation of actually what happened when the incident happened. And then there's 2 things that happen. If there is some type of permanent damage, that will be noted throughout the years after the incident by other clinicians or physicians. So we review these medical records to understand the history of the problem and exactly where it may be. Then the assessment involves a current level of functioning, which will tie in with the previous history to see if there are still manifestations of the injury within the current functioning. So whether it's a concussion or another type of injury depends on the severity of the injury, the medical documentation for a review, to review that, and a current level of functioning, and if the patient is still being affected by a previous injury.
Okay.
Okay, you have another question on a different topic. The question is, have you used luminosity and would you recommend it for brain stimulation?
As I stated, I think that one thing I've done, as Pat kind of introduced it, I researched everything that I feel is empirically evidence-based interventions that are free. I want more people to do them. I want them easily accessible. The brain training programs, there are kind of two theories about that. Many of the clinicians, we don't really put a lot of weight into them. They provide evidence that it works, but there aren't a lot of comparable studies. So all of the interventions I presented have evidence-based research. Now, different programs will find and support their programs with research, but it would have to be a study where there are two types of participants, those that use it and those that don't. But their research of their own program may demonstrate that it assists in a higher level of cognitive functioning. I do not recommend them. I really like to incorporate these healthy habits as part of your daily life, utilizing all of these things. They're these new tasks, this exploration into finding what works for yourself. This is part of self-discovery, which is so important and can utilize the wisdom later in life that all of you possess. So I encourage you to find out your own journey on brain health. Now, if that being said, if luminosity works for you, by all means, adhere to the program. But also try these other things as well, because by discovering more about yourself, you're going to be functioning, an increase in functioning as well. So go ahead and do whatever works.
Okay. The next question is, what videos do you recommend for dancing? And
okay, lovely.
how often is best to participate in this?
Thank you for that question. Yes, I think that the physical activity, remember, I'd like it for between 31 and 45 minutes a day, 5 days a week. That's the research findings. So for dance, really about a half an hour, because you'll go on YouTube and, you know, I don't know what, I can't recommend any videos. Oh, you know what? I can. Go to the library, or you can find them on the library, I think, and then just do your pickup in the parking lot. And YouTube also has great free videos. The dance step we learned today was Foxtrot. It's the simplest one. I would start with that from a video. I don't have a video to recommend at this point, but 30 minutes, probably 3 times a week to start. And then we hope that when the pandemic disperses, that we can get some programs going in Holland as well. So again, a new task is going to make you get on the computer or the library website and find videos that will work for you. So it's a little bit of being a detective and using some new brain pathways to solve that problem as well.
Thank you. The next question is, what is open monitoring?
Yes, okay, thank you for that question. The different types of meditation, open monitoring is where you sit calmly in a comfortable place and you allow, you're not gazing or focusing on something, you're allowing your thoughts to come and go. And again, you start with 1 minute, 3 minutes, 10 minutes, and you just sit in a quietly. And the open monitoring means open to the thoughts that come and go. And we try not to label them. So we don't label them as good or bad, but we monitor them. We note when they come into our consciousness and maybe when they leave. So it's just being open to the thoughts that arise as you're sitting. That's open monitoring. When I worked with the caregivers of persons with dementia, the reason they were more access to focused attention, it's difficult in open monitoring to diminish the ruminative thoughts. And when caregivers, they have a lot of thoughts going on. Even if they sit for a couple minutes, they're thinking of all the things they have to do as soon as they stand up. So the open monitoring was difficult for some people, especially if there's high anxiety or stress, but it mainly brings an awareness to current thoughts at that particular moment.
Sorry, that's my background noise. Thank you for that. I have a comment and a question. I'll read the comment first and then I'll end with the last question.
Yes.
The comment from Don is that Evergreen Commons is now open. One must register in advance, wear a mask, and follow all guidelines for COVID-19. And that's not to promote Evergreen Commons, but it's connected with your comment earlier about ways to be involved.
Thank you.
The last question that I have in the chat before maybe you open up for a moment, if anybody has something they want to verbally ask, is what is hypolipidemia?
Lipidemia is the profile, and they take that from your lipid profile when you have your physical. And we want our kind of cholesterol and all of our blood levels to be in a healthy, a healthy level. And that's why staying healthy is so important. When your physician is going to take your lipid profile, it's going to give us a picture of basically where your cholesterol levels are as well. That is something I always leave to your primary care physician, any medical component on this. And so if your physician is seeing some of these levels, not in the kind of in the level that is preferable, they will probably recommend medication or some type of diet change. We reviewed the diet changes, which will increase a healthy lipid profile. It gives us what they term as a good cholesterol level or and diminish a poor lipid profile. Now, to look at your lipid profile, I'm going to encourage you to speak with your primary care physician because I'm not sure if there's medication addressing that or not. But hypo means less than, and hyper means more than. HYPO is less than. HYPER is more than. So perhaps in the levels are low and they want an increase in some type of cholesterol or some healthy fats, things like that. but I'm going to encourage you to review that with your physician and then go ahead and follow the healthy food strategies that we reviewed in today's presentation.
Great, thank you for that.
Yes.
It is 11 o'clock, so class would be officially closing. Dr. Connell has agreed that if there are any additional questions that she'd be willing to stay on for a few minutes. I did see a couple of people had unmuted themselves. So does anyone have a question? And for those of you who have prior commitments, class is dismissed. I would say that on behalf of HASP, we want to thank you so much for an incredible amount of information and a wonderful presentation. If everybody could give Dr. Connell a round of applause. Thank you so much. We appreciate
Thank you
it.
very much. Yes.
And we'll just keep the class open for a few more moments in case
Okay.
anybody has a question.
Sounds good. Thank you so much for attending.
This is a lot of information to digest, and I was able to follow it along with your text and photos and so on. Do you have a book to suggest? I have dementia in my family, and I am 79. And I signed up for 16 Zooms, so that's good to stimulate my mind. So is there a book you might suggest with this medical information in it?
Let me look at my table. I did bring a couple books, okay? Okay, I'm going to hold this one up. And I'm going to recommend this one. It pretty much, can you see that okay?
Yes.
Okay, so I'm going to recommend that one. It's fairly accessible. Reviews a lot of what what was in today's presentation.
Okay. Wonderful.
Yeah, so I'm going to recommend that one. It's going to be easy to follow along. It's research-based and fairly accessible. It is a lot of information. And the goal is to understand how complex brain functioning is, but how also we can enhance it by doing fairly simple tools as well. So go ahead and try that book.
Thank you very much.
You're welcome. Thank you. Anyone else?
Yes. Could you just talk a little bit about the importance of spending time outside?
Oh, I could talk hours on that. Yes. Being outside, it's being in nature also takes us kind of out of our environment. So as opposed to, now I recommend treadmills in the home as well, but being outside is addressing a new experience, a novel task, a new environment, getting all that clear air through our lungs, bringing that to our minds as well. It softens the stress experience. It connects us with something larger than ourselves. So it assists on so many levels to create those new messages going into the brain. We pay attention when we're outside. We're paying attention to the way we're walking. We're paying attention to the trees, the clouds, the weather. There's so many things going on there's so much natural stimulation. And we can focus, again, we don't have such a divided attention when there's so many things going on. Nature provides us to focus just on nature. We're focusing on what is going on outside as well as what is going on within ourselves. Yes.
Thank you.
Anyone else? Thank you.
Can I ask a question? I love the picture of the footprints in the sand and the
Yes.
water. Was that from a textbook or personal collection?
No, I probably got it on my picture gallery.
Okay, all right.
Yes.
Thank you.
But yes, thank you for noticing that. It's so important when in Western Michigan, we have Lake Michigan, which is so expansive and offers us so much. So I added that one to remind us of this wonderful environment we live in and how soothing and stimulating it can be at the same time. So thank you for noting that. Anyone else?
Shannon, I have a question. Do
Yeah.
you recommend, where it's safely possible, to do these things with a buddy so that you have that support? Oftentimes we get really excited about trying these things, and then if we don't make them habits, they tend to die out of our daily activities. So just your thoughts on that.
Yes, thank you, Pat. Yeah, that's a very good question. There's two components I'm going to review with that. One is the socialization is so important, and what a great idea to think about. And thank you, the person that said Evergreen Commons is open. That tells you that I've been pulled in too tight as well. So yes, with others, really increases that socialization and what we reviewed in the presentation. So that's a very good goal to work on with someone. The second component is it's also wonderful to explore things in a solitary fashion because it is increasing your self-knowledge and what works for you. And in these tasks, remember we wanted to challenge our brain in new tasks. We're also challenging ourselves to adhere to a new task and to reflect on it. So both components are beneficial. They're just different. So I say combine them. Explore some things with a buddy, or when things are a little bit more open, starting programs for this, something like that, where small groups can do it, but also this self-exploration, what works creates a certain amount of self-responsibility within our own health and our brain health. And those are wonderful messages that the brain will receive. It'll note that she's really paying attention to me. So yes, very good question. So I think both, because anytime the new tasks, novel environments, socialization, and also self-reflection. Yes, thank you. Anyone else? Well, I think you're all on your way. This is so great. The questions mean you're thinking about this. I encourage all of you for this exploration into these healthy habits for a healthy brain, especially during these challenging times. So it's been my pleasure to be here. I appreciate to be able to do this virtually in a classroom and assist us in understanding the brain. So if there aren't any other questions, I think we'll close for the morning and enjoy the day and maybe try some of these tools.
Thank you very, very much.
Thank you so much.
Okay, thank you, my pleasure.
Thanks, Shannon.
Thanks, Pat.
Have a great day, everyone. I'm going to go ahead and close the class.
Okey
Take
doke.
care.
Thank you.
Bye-bye.